faces to your face, but just a pressure seal with a hose that generates a column of air pressure that just holds that airway open. And it sounds primitive, but it's amazingly effective.
It is room air that's basically taken out of the room and through the filter in the back of the device and put through a motor, and it's delivered through the tubing and then ultimately through the mask.
Now the new CPAP machines actually have computer chips and computer cards in them which download information which can tell us how often the person's using it, how many nights they're using it, and if it's effectively reducing their respiratory disturbance index. So we can actually just look at the chip and see if it's working.
The pressure is prescribed after what we call a treatment night in the sleep lab. You put it on while you're asleep in the lab, and the technicians adjust it by remote control to just that exact amount of pressure that holds the airway open so that you breathe easily and not excessive so that it's uncomfortable.
So CPAP stands for continuous positive airway pressure, and BiPAP is 2 levels of positive airway pressure, bi meaning 2. And really the main differences between those 2 forms of therapy is really comfort. Basically all it means is there's 2 pressures versus 1 pressure, and makes it more comfortable because as you know, we don't breathe 1 pressure. We have an inspiratory phase and an expiratory phase. The most common type of mask is a pillow mask. And we call it a pillow because it acts as a pillow. The mask actually goes inside your nares or your nostrils. There are various sizes, anywhere between a petite to a large. Your respiratory therapist would actually size you to make sure the right mask is chosen. And the reason this is so popular is you don't have anything really touching your face except the headgear. It allows movement if you toss and turn at night. You can wear glasses if you like to read before you go to bed or watch TV, and has become extremely, extremely popular. It's very easy to clean, it's easy to put back together. So there's a lot of advantages with pillow masks.
So this is the mainstay of treatment of sleep apnea because it works most of the time. Other treatment options would include an oral appliance, which is a mouthpiece that fits in the mouth. Now it's not a standard like mouth guard, it's a mouthpiece that works like braces and has a crank on it and actually works by pulling the jaw forward. So if you pull the jaw forward enough, it opens up the airway and prevents collapse.
Then the other treatments are surgeries in which they just open up the back of your throat or do various other things to open your airway and prevent obstruction.
Now this is less effective and works only about 50% of the time in patients, so it is not a primary recommendation that we make.
So I took the operation and man, that was a waste of time. It was nothing to take, and I wouldn't recommend it to anybody. In fact, I don't think they offer the operation anymore.
It can be an option still for that 50%. If people don't tolerate or don't desire CPAP for one reason or another. Once you get to the more extensive surgeries, for example, realigning your jaw, it sounds simple, but they have to bust these bones and bust your jaw, move it all forward, wire it together. It's not something that you're going to be doing every day.
And the last treatment is weight loss, because sleep apnea is related to obesity in many patients, though not all. And if they can lose weight, they can sometimes improve the apnea. If they lose enough weight, they can actually eliminate it.
CPAP has been considered the gold standard to treat obstructive sleep apnea. It works, and that's the simplest way to put it. Sometimes the struggle for patients is getting past the psychology of it.
My major concern was, how was I going to go to sleep wearing something on my head? The mask has straps from here and also from here. And when I would sleep and wake up in the morning, you could see lines in my face. And I didn't like it.
You're wearing something quote unquote called a mask. It's not attractive.
You're not going to like it for the first week or so. Oh, it's a pain to put it on and off, and If you have to get up in the middle of the night, you have to turn it off and take the mask off, and then when you come back to bed, you got to put the mask back on again.
Snakes get in the house? Hey, do you think they did? I just don't jump into bed anymore. I have to sit down, fill the water reservoir with water, put on the mask, and make sure that the hose is not under the cover, where before I could just jump in bed and go to sleep.
You not only brush your teeth when you get ready to go to bed, you dig out your machine and hook it up and throw it on the bed and then lay down and go to bed.
I think the most challenging thing is probably accepting treatment with CPAP. As you can see, it's an unusual device, so people are challenged by vanity, okay, because sleep is a very private issue and sometimes an intimate issue, so that they may be challenged by wearing CPAP and may be concerned that they're going to embarrass themselves and their bed partner, so that's a challenge.
She still sleeps in the other room, which, of course, I'd rather have her in there with me. It's an adjustment. You have to get used to this, but you have to want to get used to it.
If we can get to the education component with patients and helping them understand all the benefits that come from wearing the device, everything from a better quality of life, it could alleviate the daytime sleepiness, better mood, possibility of actually having the energy to exercise, which would then lead to some weight loss. The benefits are innumerable.
And he doesn't move all night. He just lays in one spot. And then at 4 o'clock in the morning, he wakes up and gets up because he's all slept out.
When we get ready to go someplace, we just take our CPAP machine and hoses, and we have one special suitcase. We even bought one with wheels on it so that we wouldn't have to carry it.
And you always know your compliant patients because they could be going on one overnight trip and they'll leave everything at home except the CPAP if they had to, because they know what it feels like to be sleep deprived and don't ever want to have that feeling again. The device truly makes a difference for them, and they don't want to be sleepy and tired the next day.
That's the best thing, to have a good night's sleep and not falling asleep while driving or in church. I'm doing this for 10 years now. I got it down to a science, so it's pretty easy.
We have a lot of patients that we speak to at different venues, and they talk to us about CPAP changing their life, increasing their family life, their quality of life. They will not go one night without wearing the device.
I feel better because I'm sleeping better, so I feel good.
Well, I didn't like to get up in the morning first thing. I would kind of roll around and just lay in bed a little while, but now when I wake up,
I really do feel better in the daytime. I'm a morning person anyway, so. Thank you. Oh, okay.
She didn't used to get up and go get a mop and mop the floor or something in the morning, but she does now. She bounces out of bed now and starts the coffee and comes and wakes me up. It's made a big difference in her life, and mine too.
For a hard-headed person who's been diagnosed with sleep apnea, I would say, look, get it through your head. If you want to sleep well, do what the doctor says, or else continue with your life and be, a mess.
well, anybody that's thinking about getting tested for apnea and they're kind of worried about whether they should or not, I would 100% recommend getting tested for it, because it really, really does make a difference in how you feel the next day.
CPAP therapy provides hope to patients because of the fact that if you want to have a long, healthy life. I think what's indicative of that is that you rest and take care of your body. And if you're not getting that rest, your body is going to react to that.
It helps you sleep, it makes you feel better, gives you more ambition, and I really, really think that anyone should not be worried about. The test is really nothing to be afraid of.
The normal man's mentality is that your wife doesn't know what she's talking about. And I had to thank her for making me go get that test. It was a change in my life, a simple change in my life.
So get the proper rest, get the sleep that you need, listen to the doctor, and do it. Your life will be much better, you'll probably live longer, and you'll sleep better.
We've been married 53 years. In a couple months it'll make it 54. So I guess we'll stay together the rest of our life with our CPAP machines.